Knowing how to implement a best practice guideline is an essential skill in the nursing profession. This presentation proposes the benefits for vascular access, an algorithm for blood specimen collection. In this presentation, we will cover the clinical practice setting that the algorithm for blood specimen collection via vascular access can be applied to, the clinical practice guideline it is built from, barriers to implementing recommendations, the key elements of knowledge translation tool, the implementation and evaluation of the algorithm, and a reflection about implementing best practice guidelines. The knowledge translation tool that will be discussed in this presentation is specifically designed for an emergency department that sees over 34,000 cases annually. This provides ample opportunity to care for patients requiring vascular access devices and blood specimen collection. Additionally, the nurses in this emergency department are uniquely responsible for collecting their own blood specimens and performing all point-of-care laboratory testing. Vascular Access Best Practice Guideline created by the Registered Nurses Association of Ontario RNAO 2021 serves as an excellent resource for the insertion, assessment, and maintenance of vascular access devices for patients of all ages. These recommendations are incredibly applicable to emergency nursing, since vascular access devices are pivotal interventions in emergency situations. The guideline provides evidence-based support for patient education, specialized teams, venipuncture versus drawing blood from a vascular access device, ultrasound-guided technique, and implementing pain management strategies during vascular access insertion. Barriers that can impact the implementation of best practice guidelines. Let's take a look at some of the barriers associated with the vascular access best practice recommendations. Recommendation 1.1 involves providing comprehensive healthcare teaching to patients and their families about their vascular access device. This is frequently demonstrated in the emergency department as many patients are discharged home requiring continued IV medication. A barrier to implementation of this recommendation includes a lack of access to resources. Patients are provided verbal directions, but this may not suit everyone's learning needs. The next recommendation, 3.1, involves implementing a vascular access specialist team. There is currently no designated personnel. A barrier to implementation includes organizational constraints. For instance, recruiting and training full-time staff to become vascular access specialists requires expertise, time, and clear need for implementation. Implementing a vascular access specialist team to be available 24/7 is unrealistic based on the fact that there's a lack of resources. The next recommendation, 4.1, involves nurses performing venipuncture rather than drawing blood from a vascular access device. This is not evident in practice. A barrier to implementation of the recommendation includes pushback from staff. Many nurses perform blood draws from vascular access devices because it is easier and it provides greater patient satisfaction without having to perform venipuncture. Recommendation 6.2 involves utilizing ultrasound-guided technique for the insertion of peripheral vascular access devices for individuals with difficult intravenous access. However, very few nurses are trained for ultrasound-guided technique in the hospital. A barrier to implementation is scope of practice, as this technique requires additional education and not all staff will be interested in pursuing further education for insertion of vascular access devices. Lastly, recommendation 7.1 involves providing adults non-pharmacological and pharmacological pain management strategies during the insertion of vascular access devices. Patients are rarely provided pain relief measures unless they express a desire. The time constraints are considered a barrier to implementation as patient condition or acuity levels in the department may require prompt vascular access without the use of pain management. The blood specimen collection algorithm is a knowledge translation tool designed to address the barriers associated with the RNAO 2021 Vascular Access Best Practice Guideline Recommendation 4.1. According to the expert panel, healthcare providers should perform venipuncture rather than using a vascular access device when collecting blood samples. The tool is designed to specifically address the barriers associated with pushback from staff by providing an algorithm that can help make evidence-informed decisions and educate them on the importance of choosing venipuncture versus drawing blood specimens from a vascular access device. This tool lists the key advantages to venipuncture, such as reducing blood culture contamination, hemolysis, dilution, and misdiagnosis. The algorithm is based on a yes-no flow chart that emphasizes the importance of choosing venipuncture as the primary blood collection method, especially for blood cultures and specific lab tests such as venous blood gases. Furthermore, the algorithm is supported by evidence-informed practice. For instance, Malloy et al. 2018 suggests blood cultures are accurately obtained from a peripheral IV up to 1 hour following insertion. Convery et al. 2019 suggests drawing venous blood gases, potassium, bicarbonate, chloride, or glucose from peripheral IVs can cause inaccurate results. Hence the need for the box in the middle of the page asking, does the patient require close monitoring for any of the following lab tests listed in box 1.1. According to Twiebel et al. 2019, hemolysis is 5 times more likely to occur with blood samples obtained from peripheral IVs when compared to venipuncture. However, the algorithm does suggest drawing blood from a peripheral IV as a last resort, with a reminder to properly document the method of blood specimen collection. According to the World Health Organization 2023, it is acceptable to collect blood specimens before connecting the cannula to the IV. Additionally, in accentuating circumstances, it may be necessary to draw from an IV and document appropriately. Now that a tool has been developed, it is important to consider implementation strategies that can promote the blood specimen collection algorithm. First, nurses should be provided education surrounding its importance and how to utilize it. This can include identifying early adopters of the algorithm and selecting a champion to help educate others in the department. In fact, Georgia et al. 2022 proposed designating a champion is a key indicator of success for implementing evidence-based nursing interventions. Additionally, Tao and McCurry 2019 proposed innovative technology-based teaching strategies can help increase the learner's engagement and strengthen clinical reasoning strategies by practicing scenarios that require application. This could include yearly mandatory modules that engage nurses in utilizing the clinical algorithm. Lastly, alternate forms of educational materials can help spread awareness of the tool and can be provided in the form of handouts, emails, and posters. Furthermore, developing a policy that includes the blood specimen collection algorithm can aid in the implementation process, according to Spironi et al. 2020. Policy making is an essential part of translating evidence-based findings into clinical practice and performing shared governments and leadership. Therefore, policies help ensure consistency when implementing a new evidence-based practice. Involving the policymakers and experts in the field can help implement the policy at various levels, starting in the emergency department and working its way up to organizational or systemic level. Evaluation is another important consideration. McKeevy et al. 2020 proposes auditing relies on realistic and reliable statistical collection of data to monitor the progression of implementing a new framework such as the blood specimen collection algorithm. For instance, the new current program utilized for documentation by the hospital prompts the nurses to identify whether the blood specimen was collected from venipuncture or a vascular access device. This is an excellent strategy for measuring the desired outcome of implementing the algorithm, which is to decrease the amount of blood draws from vascular access devices. Additionally, the rate of hemolysis can be utilized to track the quality of specimen collection. Defer et al. 2019 proposes an auditing and feedback program serves as an important measure for monitoring the impact of nursing interventions that can have on patient outcomes. This can be demonstrated by collecting nursing feedback through hosting huddles, providing opportunity to discuss questions and concerns, and collecting patient satisfaction with blood collection. Being familiar with best practice guidelines are an essential part of working in the nursing profession. Although it is expected that all nurses are familiar with BPGs and implement them into practice, there are many challenges that can act as barriers. For instance, limited access to resource or time constraints. Getting involved in policy-making procedures can help promote the implementation of these recommendations. In addition, evaluating these strategies is essential. Overall, the development of the blood specimen collection tool has highlighted the importance of utilizing best practice guidelines in nursing practice to promote optimal patient care outcomes. Here are the references utilized to create this presentation.